As I'm sure most of you know, Senator Hassan began her first term as a United States Senator this year, and prior to that served 2 terms as governor and 6 years in the New Hampshire State Senate. New Hampshire Medicaid's conversion to Medicaid managed care and the creation of the New Hampshire Health Protection Program happened while now Senator Hassan was governor, so no small changes to Medicaid under her purview. And currently, Senator Hassan is a member of the Senate Committee on Homeland Security and Governmental Affairs, the Committee on Commerce, Science, and Transportation, the Joint Economic Committee, and probably most pertinent to this event, the Committee on Health, Education, Labor, and Pensions. We really do appreciate Senator Hassan taking time to join us today to provide an update about the work that the US Senate is doing on health policy with a focus on Medicaid. And we all know there's no shortage of things to talk about. So with that, please join me in welcoming Senator Hassan.
Well, Joe, thank you so much for the introduction, and to you and the Institute, thank you for hosting today's symposium. I have to give a special shout out to the wonderful Lucy Hodder, who, as Joe was just talking about the things that happened while I was governor in terms of health policy and Medicaid policy, it wouldn't have happened without Lucy Hodder. So you all should know that. It also wouldn't have happened without Pamela Walsh, who was my chief of staff at the time, who's over here and still working with me in the Senate. And it also wouldn't have happened without a lot of you in this room. So I am very, very grateful to all of you for the progress we have made. I am also grateful to all of today's speakers. I caught a little bit by live feed when I came in of the last panel, and I thank you all for participating. I thank everyone in attendance for keeping focused on how we can improve health care for the people we all want to serve, the people of New Hampshire, the people of our country. And I was reflecting as I was listening to the last panel about the fact that you guys were talking about what we should be talking about in Washington, which is how we reform the Medicaid program, how we reform health care, how we improve the Affordable Care Act, address some of the issues that we know have developed and that we knew when you do this kind of transformation and change would need addressing. Sadly, I have to tell you that's not what we're talking about in Washington, at least most of the time. There are certainly members of the Help Committee who know what we should be talking about. Frankly, the people on both sides of the aisle who know what we should be talking about. There are people like me who have been governors in the United States Senate, and they certainly also understand what's at stake here. But what we are talking about instead is really, at some level, whether the Medicaid program as we know it and as we have known it since its inception is really going to survive. I think it is, but it isn't going to happen without the work of all of us and many, many others. I know I am speaking to one of the most knowledgeable crowds in the country on this issue, but I do want to take a moment just to talk about what Medicaid really means to the health and well-being of Granite Staters and people throughout this country. We know it's important to the delivery of basic health care to people like all people who need it. We know how important Medicaid expansion is in addressing our efforts to combat substance misuse and behavioral health issues. Unfortunately, what we see in DC right now is a true assault on the very existence of Medicaid. The cuts that are proposed in the president's budget would be devastating to thousands of Granite Staters who rely on Medicaid for quality, affordable health insurance coverage, including low-income citizens, including our seniors, including those struggling with substance misuse in the middle of this terrible epidemic. Over the last few weeks, we've heard just how devastating Trump care would be to the health of millions of Americans. Trump care fundamentally alters the very nature of the Medicaid program, putting in place per capita caps, which, as you all know, is just code for making massive cuts, $800 billion in cuts over the next decade. Trump care also ends Medicaid expansion. And in addition to the threats to Medicaid in Trump care, There are threats in terms of Medicaid cuts in the budget that was just released. On top of the $834 billion in cuts to Medicaid and Trump Care, this budget proposes cutting another $610 billion. So what does that mean for our people and our state? Our efforts to combat substance misuse would be severely impacted. Medicaid, as you all know, has been critical to ensuring that Granite Staters struggling with addiction have access to treatment and recovery services. I was honored to invite as my guest to the President's address to Congress in February, Ashley Hurto from New Hampshire. Ashley lost her husband to an overdose in December of 2015, and she herself was also misusing substances. She got on Medicaid expansion through drug court. She is in recovery. She is employed by a private employer. She now gets her health insurance through that private employer. She is making her way through. She is recovering. She is reestablishing her relationship with her 3-year-old child. That is the power of Medicaid expansion, and it is Ashley's story and the story of so many other people who are impacted by this terrible illness that is one of the stories that we need to keep telling. And I am really proud that we came together and crossed party lines in New Hampshire to get Medicaid expansion done during my time as governor. I'm proud of what it's been able to do for people like Ashley. I hear from providers and experts in the substance misuse field that Medicaid expansion is the single biggest tool they have to making sure that they can provide coverage. So one, we have to do everything we can to help people understand the impact of Medicaid expansion, where the money comes from, and what it helps the people who are covered by expansion achieve. We also have to talk about other aspects of Medicaid so that people really understand what's at stake here. One of the things I have direct experience with, not only as a governor but also as a mother, is the impact that Medicaid has on our capacity in our schools to provide critical medical supports to children with disabilities or chronic illness who are included in our school systems. It has helped school districts cover costs for special education services and equipment. And one of the provisions in Trump Care and the budget is that states would no longer have to consider schools an eligible Medicaid recipient, right? And overall, New Hampshire gets about $29 million. New Hampshire school districts receive about $29 million in Medicaid dollars to schools right now. You take away the requirement that states consider schools a provider, along with a cap, which means there are fewer resources to go around. And this not only impacts children in schools, but if schools are going to continue to live up to their responsibility under the law to provide free and appropriate education to all children, it's a huge downshift to local school districts who are still going to have to pay for these services. These are services, for instance, for school nurses, for behavioral health services, for health screenings, for equipment and supplies, even for after-school programs. And the quality of education for all of our students really gets impacted dramatically if this cut Medicaid to schools is carried out. We also know how important Medicaid is to older Granite Staters. It's important in their ability to stay engaged in our communities. And under the budget and Trump Care, Medicaid, which helps pay for 2 out of 3 individuals in nursing homes in New Hampshire, 2 out of 3 individuals, again, faces cuts. Medicaid also helps provide home care and transportation to and from medical appointments for seniors. So again, as you think about kids in schools, think about seniors with home supports, getting transportation to medical appointments or in nursing homes, and you think about the magnitude of the cuts that are being proposed, and you are talking about a significant change in the capacity of our seniors to stay engaged or get the quality of care they need if they need to be in a nursing home. We all, I think, want to honor our commitment to our seniors, but with this type of Medicaid cut, it gets a lot harder for us to do at the state and local level. I'm obviously going to continue to do everything I can to stand up for the people of New Hampshire who are served by Medicaid, along with other programs that are being threatened by this administration. I'll continue working with concerned Granite Staters and key stakeholders and my colleagues across the aisle in fighting these dangerous cuts, because they would really pull us backwards. I know that Senator Bradley spoke here earlier this morning, and Jeb and I have actually worked together really well over a number of things, including Medicaid expansion. And somebody indicated that he had kind of said something along the lines of, look, we can't control what, you all can't control what happens in Washington, so we have to focus on what we can do here. It is true that you should continue to focus on reacting to what happens and being, developing the best services, the best programs, the best health care at the best value that you possibly can. And integrating health care is a huge piece of that. And I really wish that's what my help committee was talking about all the time right now. But I don't think it is quite right to say that you guys can't control what happens in Washington. About 6 weeks ago or so, when the House was considering passing the first version of Trump Care, I joined Americans who happen to experience disabilities from around the country at a major press conference outside the Capitol. People from all over the country with all different levels of experiences with disabilities, their family members, their advocates, their champions. That experience, along with the calls and the letters, the Facebook posts about what healthcare had meant to individuals across our country, made a huge difference. When senators' phones ring off the hook, when they get thousands and thousands of emails, not just saying, please don't take Medicaid away, but explaining what the program has meant to the quality of life of a constituent, it makes a difference. When providers get up and say to a United States senator or a congressman or a president's staff, look, we've been able to provide substance misuse services to thousands more Granite Staters because of this money, and this is how we did it. And we'd like to expand services, but if we don't know that the money's coming to us, we can't do that. When real people talk about the difference healthcare has made in their lives, that they've gone from being somebody in and out of emergency rooms who couldn't work because they could go to an emergency room in crisis but never be able to truly afford long-term primary care for their health issue. They get Medicaid expansion, they get a primary care doctor, they get treated, they get better, and they go to work. And they have the dignity and independence of work. That's what healthcare means to Americans. You all know that better than most. You have stories to tell. You have patients who have stories to tell. You have friends and neighbors who have stories to tell, and who have the absolute right, and I would argue the obligation, as Americans, to remind people in Washington that we are a country that stands for the principle that every single human being counts. Every single human being has the right to participate as a full and equal citizen in our communities, in our democracy, and in our economy. And that starts with having access to health care so that they can have the kind of life that allows them to be the kind of Americans that we all want to be together. So I am grateful to all of you for all the work you're doing. I always look at rooms like this and say, I have no right to ask you guys to do a single thing more. But I do, because the future of our country is at stake, the future of our democracy is at stake, around issues like whether we are going to continue through our elected representatives in a government of and by and for the people to make decisions about what we're going to do together and how we're going to support each other so that we can all thrive as Americans together and lead and grow as a result. So thank you for having me today. Keep working, and I look forward to continuing to fighting for our people with all of you. Thank you.